All right. Thank you to everyone for taking your time to come today. Here is what we're hoping to cover in our orientation meeting today. We'll have introductions. We'll talk about the overview of our training of the trainers course, a little bit about why we from Vanderbilt are here and why you guys are here for this training. Then we'll spend some time talking about the logistics of the course, what our expectations would be, and then we'll have some time at the end for question and answer. So let's start with introductions. We will start with introductions from the Vanderbilt team, and the way we're going to do introductions is multi-millionaire status while helping others reach. Thank you, whoever joined. Thank you for muting. After you introduce yourself, we'll just have you pick the next person that will introduce themselves, and we'll keep it going that way. So I will start. My name is Bantayo Seleshi. I was born and raised in Ethiopia. Came to the United States to pursue my studies. I'm a cardiac anesthesiologist in training, and I am the fellowship director of our cardiothoracic anesthesia fellowship at Vanderbilt. I've been doing work in Kenya, in Ethiopia for the past 7 years, and my passions are education and global health. I am married and I have 2 kids, 16-year-old son and a 15-year-old daughter. So that's me. So next I'll pick on Marie. If you can introduce yourself.
Thanks, Bon. So fantastic to be with you all, and I'm really looking forward to getting to know you and really building these relationships over the next few months. So this is an exciting opportunity. My name is Marie Martin. I'm the Associate Director here at the Vanderbilt Institute for Global Health, and we love partnering with the Department of Anesthesiology here at Vanderbilt. It's really just an incredible partnership. So glad to be a part of this. I, at the Institute for Global Health, direct education and training programs along with my colleague Elizabeth Rose, who will introduce herself. My training is actually in international education and public policy, and I find myself at the intersection of education policy and global health. And I've been at the Institute for around 11 years and at Vanderbilt for nearly 20, which is hard to believe. I have 2 kids, an 11-year-old son and a 7-year-old daughter, and am from Atlanta, Georgia originally, which is in the southern part of the US, but have been in Nashville for quite some time. And I have a deep passion for faculty development in particular. So this being with you all is really a fantastic opportunity. So I will pass it along to Elizabeth.
Hi, thanks, Marie, and thanks, Bon, and good afternoon to everyone. I am so thrilled to be part of this and excited that we are finally kicking off this Training of the Trainers course. As Marie mentioned, my name is Elizabeth Rose, and I work with her at the Vanderbilt Institute for Global Health. And along with Marie, I help direct the Master of Public Health program and the Global Health track that we have there. My interest in my training is all of my training has been in education and then some in public health. And right now I'm working on a doctorate in education that's focused in organizational leadership. So I'll be doing the sessions on leadership with you guys. I'm looking forward to those. My passions and interests lie in education, in training, in global health, and in research colonialism. That's where my doctorate is focused. So I'm looking forward to these next few months with everyone, and thanks for joining us. And Claire.
Thanks, Elizabeth. Good afternoon to everyone. It's really great to see all of you And we're so excited to start this course. We've been working really hard on it for the past few months, and we're glad you all were able to join us on a Saturday. I'm really looking forward to getting to know all of you over the next few months. My name is Claire Posey, and I am not a faculty member or professor, but I am a program manager. I manage the Impact Africa program and other global anesthesia programs. I work closely with Dr. Saleshi and others in the Department of Anesthesiology at Vanderbilt. And my role is really in kind of helping manage logistics and administrative issues. So I'm really just here to help. Any questions that you have kind of related to logistics about the course, feel free to reach out to me anytime over Telegram. I'll be probably the one emailing you and communicating with you a lot. So I'm really just here to help. I guess my background is in international development. And I've been lucky enough to travel all over the world. I've been to Ethiopia a couple of times, love it. And just personally, I don't have any kids. I'm married, and I have a cat. So that's me. So we're gonna do this popcorn style. So I'm just gonna pass it to the next person, and then they can pass it on. Dr. Saleshi, did you stop sharing your screen or? You're mute. You're muted.
Yes, I did. Do you want me to share the screen again?
Yeah, well, we had a question that we wanted them to answer, I think.
Yes, ma'am. There you go.
Yeah, so I think we wanted all of you to answer, tell us your name, what institution you're from, how many years you've been practicing anesthesia, and then also how many years you've been an educator, if you're already an educator, and then what do you hope to learn from this training? So I'll pass it to Destalem.
Okay, I am Destalem. So I'm 29 years old. A young physician who graduated anesthesiology just 6 months back from Black Lion Hospital in Addis Ababa, the capital of Ethiopia. So I have been practicing anesthesiology for just six months. Before that, I graduated as a general medical practitioner and worked as a general medical practitioner for 1 year in one of the university hospitals in Ethiopia, Aider Hospital in the very north of Ethiopia. Yeah, so it's just 6 months since I am graduated, and I have been practicing anesthesia as a specialist clinician. My training was in Black Lion, as I mentioned, for 3 years, and I got it over 6 months back. So my personal life, I am not married. The thing I expect from this training is, as we have a plan to start a residency training, unlimited time and actually unspecified time, but maybe within the coming 6 months at most. So I guess this training will give me somehow a hint on how to teach residents, as I have not been exposed to teaching residents, and yeah, the techniques, the assessment methods, as well as the non-technical skill of teaching residents. Thank you.
Great. Destalem, you get to pick who speaks next.
Yeah, so my next, I pass this introduction to Hussein Emris.
Thank you, Destalem, for giving me this chance, and thank you, everybody. I'm happy to meet you guys through this Zoom meeting. As Destalem has mentioned, I'm Dr. Hussein, currently working in Gondar University Hospital as can you hear me all?
Yes.
Okay. At the consultant anesthesiologist here in Gondar University Hospital. It is a comprehensive specialized hospital, and I'm the only anesthesiologist here. I'm originally from the Wollo, it's part of Ethiopia, and I took my undergraduate in medical education in Gondar, and then I joined my anesthesiology residency in Addis Ababa together with Stalin and most of others. And it's just 6 months since I graduated, and I'm, I have learned that a lot is expected from us, as few anesthesiologists are here in Ethiopia, specifically in my institution. So I hope I will get a lot of things what's expected from me, how to solve the challenges that I will face in developing future anesthesiologists and so on. So I hope it will help me a lot.
Okay, who's going to speak, Hussein? You get to pick who speaks next.
I pick Dr. Gosa Tasfai.
Okay.
So I'm Gosa. So I'm from Bahar Dar University. I have been just practicing anesthesiology for the past 1 and almost 10 months. And I graduated from Bahar Dar University with medical doctor just 5 years ago. And I joined my residence program at Addis Ababa University, and I graduated there for just 2 years back, and I'm practicing here in Bahar Dar University. And currently I'm department head of anesthesia and ICU director of Tababagyon Hospital. And we have undergraduate anesthesia students, and we have almost 3-4 batches, and we graduated 1 batch last year, and we are going to graduate the other batch. And lastly, probably I'm married and I have 1 kid. And I expect from this theory that hopefully we will have a lot from this theory, because we are going to open a residency program, anesthesia residency program, and we are going to mentor our students. So we expect a lot from this theory. Thank you. Probably I will give the next chance for Dr. Adana.
Okay. Okay. So until Dr. Adana sorts his ability to chat, how about I pick on Dr. Blen?
Okay, thank you. I'm Blen Ayala. I'm a consultant anesthesiologist at Black Lion Hospital. I'm a junior anesthesiologist. In fact, I have less than 6 months experience as a consultant anesthesiologist. Currently, I was on maternity leave, and it has been like 3-4 months since I'm back to work. I did my undergraduate at Jumma University and postgraduate here at Black Lion Hospital. And I'm a staff here. I'm married. I have 2 kids, 1 4 years, and the other one is 8 months old girl. And I'm very happy to join this. And my expectations from this training is to be how to be an exemplary and a good teacher, to get a balance between an adult teaching and spoon feeding. And I also hope to share the different experiences of yours at different institutions and what works for you in order to get the intended products of the teaching. Thank you very much.
Great.
And if I get the chance to choose as well, I will choose on Zamana.
Okay. Samar?
Yes.
Okay. Thank you. I have a difficulty with the video, and I'm Dr. Zamana Yayu, and I'm anesthesiologist at Yekati 12 Hospital Medical College. And as I'm the same batch with Dr. Dastalam and Dr. Blaine. We have been 6 months since we graduated as anesthesiologist, and my undergraduate was Gondar University, and otherwise I'm single for the time being, and I think from this training I expect I may get some skills to be a good teacher, and some skills and knowledge to be a good teacher, and also it will develop my relationship with different people from different corners. I expect that. Thank you. So let me give the chance for maybe Dr. Adana.
I think we're having audio issues with Dr. Adana. I don't think we can hear him. So you pick on somebody else that has not gone yet.
Okay. Maybe Dr. Sagai?
Dr. Sagai.
Hello, everyone.
Hello.
Hello, thank you. I am glad and grateful to get this opportunity. And I want to thank Dr. Ban and all of you who made this possible. And I want to say hi for my Ethiopian friends. So I am Sagai, newly graduated anesthesiologist from Black Line Hospital, Addis Ababa University. I have been practicing anesthesiology for the last 5 months. Aksum University, specialized hospital. I followed my undergraduate study in Kala University, was medicine, and I'm married, father of one 3 months old daughter, and from this TOT course, I hope I will get I will improve my leadership quality, communication ability, and I hope this will open a chance to get in touch with many people as well. Thank you for having me.
You're going to have to pick somebody. You're muted, so we can't hear who you picked. Guy, you're muted, so we did not hear who you picked.
I would like to invite Dr. Aman Idao.
All right. Dr. Aman. You're muted, so we can't hear you.
Can I continue?
Now we can hear you.
Okay. I'm joining late this program and I didn't hear most of the content that you passed, or everybody that was spoken, and only hear the Dr. Sagai's voice. And as I think it is a part of also speaking or making present our service to the others.
Yes.
As
So
I think. My name is Aman Idao. I'm an anesthesiologist.
Go ahead.
I'm a new graduate anesthesiologist from Arama University. Glad to get this opportunity, and I'm very thank you. Maybe the connection is very low here, and it is difficult with the connections. Is the voice can be here?
Yes, we heard what you said. You're from Haramaya University, and that you came in late, so you missed the early parts. So we will fill you in. Why don't we go to Dr. Idosa?
Thank you. Do you hear me?
Yes.
Okay, thank you. My name is Dosa Kajela. I am an anesthesiologist. I have been practicing as an anesthesiologist for 3 years. And I graduated both under and postgraduate from Jimma University Medical Center. And currently also I am practicing anesthesia, and I'm teaching almost about 26 anesthesiology residents, and almost more than 60 undergraduate students. And I'm married, and I have 11-month-old daughter, and I expect from this TOT training, I expect many things, and I hope I will shape the teaching methodology for my students. And I would like to thank you for you have created this course for us. Thank you.
You're welcome. Who do you pick on that has not spoken yet?
Okay, I want to pick up Brani Tasfai.
Okay.
Okay. Can you hear me?
Yes.
Okay, thank you all for having me. So I'm Brhana Tasfai, 30 years old anesthesiologist. I'm married and I'm a father of one. I have a 3 months old boy. So my undergraduate program was my undergraduate program was in Addis. I did my undergraduate study in Addis Ababa University, and my postgraduate study in the same in Addis Ababa University. I'm the same batch with Desta Alam, Zamane, and Blaine. And currently, I'm staff in Addis Ababa University College of Health Science. And of course, I'm participating in teaching activities. We are teaching residents, and I'm very happy to be part of this group. And I want to thank Dr. Bantayo for preparing this meeting. Thank you. And my next, the next, I will invite Dr. Enoch.
Hello, how are you? I'm Henok Isaias. I'm also batch of 2019, which completed 6 months back. And it is the first time that I have seen some of my colleagues after 6 months. And I'm living with my fiance, which I am planning to be married soon, hopefully. And currently I am working at Haas University. And I'm department head of anesthesia and anesthesiology. We have BSc undergraduate non-medical, non-physician anesthesia provider training program. And we are planning to start a residency program soon with my colleague, Dr. Kirube, who is also working with me. So, and I expect from this training to be able to be a better educator for my residents, which I hope will be in the near future. Thank
you. Good. So is Dr. Kirubel on? So I see someone with Galaxy M20. I don't know who that is. So if you have not spoken yet, if you can go ahead and unmute yourself and introduce yourself.
Okay, hello. Can you hear me?
Yes.
Okay, I'm Matthias Nuguse.
All right.
Dr. Matthias Nuguse from St. Paul's Millennium Medical College. I graduated from Addis Ababa University 3 years ago. I'm working at my current hospital for the past 3 years. I have around 29 residents in my department. I'm currently postgraduate coordinator, and I graduated my undergraduate study from Jimma University, and I'm married, father of one daughter, 1-year-old daughter, and hopefully I will get much from this TOT since I am the coordinator of my the postgraduate residents. So I may have some benefit from this TOT as I need so that I can transfer my knowledge to my residents to show them how to teach their residents, how to explore their techniques. So I'm happy to have you as the coordinators, and thank you very much. Thank you.
Great. Okay. So I think it's just Dr. Adana we have not heard from who's on here. Have I missed anyone? Right? I think everyone has spoken. Man, it's, I am excited, encouraged to hear everybody's story. And I'm sure Marie Elizabeth and Claire, you can see we have young anesthesiologists, some of them put in very high leadership positions. I mean, you can't think of, someone who graduated from anesthesia and now they're the department head. So you can imagine the challenges of that. So I am excited. You guys chose to be part of this training. I'm going to go back to sharing my screen. You see my screen? Okay. If you can mute yourself so the rest of us can hear. So next section is, I'm just going to give you a very brief overview of the TOT. So here's the training course at a glance. The things that we would like to cover, we'll spend a very little time talking about learning theories, but a good amount of time talking about instructional methodologies, how to do PowerPoint, how to teach in the operating room, how to use the classroom more effectively. And then we'll also spend some time talking about mentoring and leadership, because those go hand in hand with being an educator. Typically, when we do this TOT course, we do it in person. It's a 2-week intensive in-person course. But because of COVID, we had to change our strategy a little bit. So we decided to do part 1 online, and which is why we're doing this Zoom course. And then we will plan to have part 2 in person, sometime hopefully in the next 6 to 8 months when the COVID situation is clarified, because there are certain things that you just cannot do online, and that you have to do in person. So part 1 online, we'll talk about techniques of effective teaching, student-centered learning, course planning and assessments, principles of leadership and mentorship. And then when we come together in person, we will try to maybe hone down on some of these skills, in addition to teaching you how to do effective teaching in the operating theater, as well as how to use medical simulation. For the part 1, for the online course schedule, here are the 12 different modules that we have. And again, we'll go over this again, but I wanted to give you a brief overview of what each session would look like. In terms of the structure of the course and the time we're going to spend together, we will try our very best, even with the limitations of being on Zoom and being online, to model to you how we hope that you will teach. So we will have times where we will do didactics, and then we'll do small group work. We'll have some role play. We'll give you some time to think, talk about, pair you with people, and then share your thoughts, including case studies and so forth. So it will not be, me or Marie talking for 90 minutes straight. There will be a lot of interaction during each 90-minute session we're going to spend with you. All right, so why you and why us? It's important to kind of set, to have an idea of, why we're doing this. So I'll start with why us, why me, Marie, Elizabeth, and Claire, and the rest of our global health team at Vanderbilt are doing this. So the first part is personal. I think each of us have our own personal experience and practice that has made us passionate about doing global health. So for me, I was born and raised in Ethiopia. I knew growing up, I knew what it meant to not have good healthcare infrastructure. So when I came to the States, I knew that I was going to contribute somehow back to the to the country in terms of improving healthcare. So doing this for me it has a lot of personal reasons. Marie, if I can put you on the spot, can you tell, like for 1 minute, can you tell us a personal reason why you pursue global health?
Thanks, Bon. So I am, my deep passion is to apply my skills and my interest and my goals to those in settings where there are low resources. And I've worked for nearly 20 years building human capacity abroad. And it has been a gift to walk these academic paths with other people and feel like we are partners in an effort to improve the health and well-being of populations that, like Bon had mentioned, have limited access to health services. So that is principally why I'm here, and I've worked across the continent of Africa, primarily in Zambia, South Africa, Kenya, and Liberia, but have not yet had the opportunity to really engage in Ethiopia. So this becomes a unique opportunity for me to know you, to learn from you as I'm teaching. This is a mutual benefit, and really think about the ways that we can continue to grow our networks, grow our skills, and be better, stronger partners.
Cool. Well, Elizabeth, can you spend 30 seconds or 1 minute just speaking to the personal aspect of why you pursue global health?
Yes, certainly. Well, and I'll also speak to why I pursue education, why I'm in this. For me, I feel like each one of us has our own special skills and gifts that we're able to give to our communities and give to the world. And my area, I believe, is in education. I've been working in education, studying education, teaching for about 15 years now. And I'm excited to continually share those tips and techniques and theories in education, now leadership, which is a new specialization for me, with others, so that you guys can take those. And like many of you said, you're starting residency programs, you're already teaching undergrads or residents, and being able to just strengthen the skills you have so students can learn better and have increased impact on your communities. So I'm excited about this.
Thank you. So one of the reasons is personal. The other reason we're pursuing this is, in terms of when I was in training as a resident, I was able to identify people who knew how to teach. Not every faculty member was good at teaching. And during my residency, I didn't get any training on how to be an educator. And then here I am working in an academic place. Through my residency and as an academician, I have learned a difference that a great educator and a great leader makes in terms of students being successful in pursuing whatever career that they're carrying. So that's a second reason why most of us do this. A third reason is not only am I passionate about education or leadership, but most of us have decided to choose global health as our career. So in big academic center like Vanderbilt, most people choose their area of expertise and their specialty. So some people choose clinical research, some people choose basic science research, and most of us have made our choice for global health to be our career. So that's another reason why we are involved in doing this. And then lastly, especially for me, at the end of the day, if it does not, whatever we do, if it does not translate into improved patient care, then I consider it as a waste. So I am hopeful that through all the efforts that we're doing, that will improve anesthesia care in Ethiopia and all the countries that we work in. So that's why we are doing this. And then why did we choose you? Well, this program was specifically focused on anesthesiologists and improving anesthesiologists. So that's why you were chosen. You were also chosen because most of you, if not all of you, are working in academic institutions where teaching and leadership is expected and is supposed to be shown. Most of you are working institutions where there's a residency and one of our goals is to strengthen and improve residency trainings in anesthesia, especially when it comes to quality anesthesia care. You have to have quality anesthesia education. And you were chosen because you practice in places where training happens. And lastly, and you've kind of proved our point for us, that most of you are very young educators. Some of you have been doing this only for 6 months. I'm glad to see that we have a couple of people who've done this for 2-3 years, so they can share their perspectives with us as well. So that is why you were selected, and that's why you're here with us. All right. Now we're going to move on to logistics. So I'm going to stop sharing my slides, and then I'm going to have Claire share her slides, and she's going to go over logistics with us.
Yeah, thank you. Okay. Can everyone hear me okay?
Yes.
Thumbs up. Okay, great. All right. So we'll just take you through a few logistics, and then at the end, I did want to remind you that we will have time for questions and answers. I feel like there may be some questions that come up around logistics, so we'll definitely get to those at the end. So this is the course schedule, and this was sent out in an email, so you may have seen this before, but you can see that we have 12 modules. So in addition to today's meeting, we'll have 12 other meetings every Saturday starting October 3rd. So you have a break next Saturday, and then we'll be seeing each other every Saturday through December 19th. And we will typically meet for 90 minutes. And like Dr. Saleshi said, it's not going to be straight lectures, it's going to be interactive. So we'll try to make those 90 minutes exciting and enjoyable. So I did want to point out that the time will change. So the first several sessions will be starting at 3:30 p.m. East Africa time. And in November, that's going to change. And that's just because there's a time change in the United States. So we'll remind you about that when it gets closer to time. But I just wanted to note that right now. And then the very last session on December 19th will be longer. It will be 3 hours, I believe, and that's because we'll be doing presentations that day. So each of you will be giving a presentation, so we need more time. Okay, and then a note about communication. So we've already started doing this a little bit, but I wanted to remind you that we'll be using email to communicate with you primarily about assignments and sharing resources. We may, send the slides after a session. So it's really, really important that you check email regularly, at least once a week. And then we also have started a Telegram group, and I know that many of you already use Telegram, so we're hoping that this will be an easy way for you to communicate with us, ask us questions. We'll send reminders through the Telegram group. And so I just wanted to say right now, if you're not already a part of the Telegram group, I think I have almost everyone. If you're not in the Telegram group, if you were just in the chat box, and I'll show you how to use the chat in a minute if you don't already know, just send me your mobile number and we'll try to get you added to the Telegram group. Okay, a few basic tips on Zoom, and I see a lot of you are already doing some of these, and that's great. So the first thing is to always mute your microphone when someone else is speaking. That's just to respect the person who is speaking and also to to cut down on background noise, which may be distracting. And then of course, when it's your turn to speak, remember to turn the microphone back on so we can hear you. Another tip is to turn off the video to save bandwidth. It's really nice to see everyone's face, especially when you're speaking or maybe when we're doing an activity where it's helpful to see each other. But if the connection is bad, you may want to turn off your video because that will help. And then another thing is there are two different ways that you can communicate with us while someone else is speaking. If you don't want to interrupt, you can use the chat box to send a message, and I'll show you how to do that in a minute. Or you can raise your virtual hand, and then the speaker will see that you'd like to speak and they can call on you. And I'll show you how to find that. And then lastly, I'll show you how to change some of your viewing settings in Zoom. Okay, so I wanted to show you the two different places where you can turn your microphone on and off, or to mute and unmute. So the first place is in the bottom left-hand corner of your window. You see the little microphone icon. And then if you have the participant window open, you'll see a microphone there as well. And you can mute and unmute yourself next to your name. Okay, and then right next to the microphone, there's also a, sorry, I'm muting someone. Okay, right next to the microphone, there's also the video option. So you can start video or stop video to turn your video on and off, the same places, right in the bottom left-hand corner, and then also in the participant panel. Okay, and then this is, obviously you can see kind of what it looks like if the video is turned on or off. I wanted to show you where to find the chat window. So right here in the bottom of your toolbar, there's the little icon that says chat. It's right in the middle. So if you click on that, I'd recommend that you click on it now so you can see what it looks like. If you click on that, it will open a chat panel, and you can see that, and you can send messages. You can send a message to everyone, so everyone in the group will see what you've written. Or if you want to message a specific person and do a private message, you can select that as well. You can see where the arrow is pointing to this little menu. You'll be able to choose any person in the meeting to send a private message to. So I'm just going to try that right now and make sure that everyone can see. Okay, if you see my message, write me back. Say something. Awesome. Great. All right, so that's the chat. So anytime, during a Zoom session, feel free to send us a message. If you have a question or comment, feel free to put it there in the chat and we'll be able to see. And then I also wanted to show where you can raise your virtual hand. So the participant window, again, it's an extra window you can have open or closed. So if you click on this participant icon in the toolbar, it will open this window here to the side. And at the very bottom, there's a little blue hand icon. So if you click on that, the speaker will be able to see that your hand is raised and they can call on you. Okay, now I want to show you a couple of different viewing options. So right now, what I have on my screen is it's in the gallery view. Oh no, it's in speaker view, sorry. This is a little confusing because when it's in speaker view, it says gallery view. When it's in gallery view, it says speaker view. But basically, this is just how to manipulate what you're seeing on your screen. If you want to see primarily just the person who's speaking, maybe if we're doing a lecture, you can turn it on speaker view by selecting this icon up here in the top right corner. And then if you click it again and go back to gallery view, you'll be able to see everyone who's in the course. So you can try that right now and just click on speaker view, click on gallery view, and see how it changes. It may be helpful to change the setting depending on what we're doing. If we're having a group discussion, it may be helpful to have gallery view on so you can see everyone talking. If it's more of a presentation, it may be more helpful to have it on speaker view. And then the last thing about viewing options that I wanted to show you is called side-by-side mode. So if someone is sharing a screen like I am right now, you have the option under View Options up at the top to select side-by-side mode, which you can see here in blue. This will allow you to see both the video of the person who's talking or the videos of the group if you're on gallery view, and the slide at the same time, which might be useful. Okay, and then the last thing that I wanted to show you all about Zoom is polling. And this is something that we may use from time to time throughout the course to just ask questions of the group, maybe to do a pop quiz. So we just kind of wanted to practice that today and make sure that it's working, and so that you all kind of see what that looks like. So we're actually going to try to do a poll right now. It's very short, only 2 questions. So I'm going to see if I can launch this. Okay, I've launched the poll. So you should see a pop-up on your screen that has 2 questions. So answer those questions and submit when you're finished. And if you don't see the poll, send me a message in the chat and let me know. Do you all see the poll? Okay.
I do.
Okay.
Yes.
Okay.
So far we have 8 out of 15 people respond.
Okay.
Be nice if we let's give it 30 more seconds and
then I'll close.
See if we can get close to 100%.
Okay.
So if anyone is having an issue with the poll, either raise your hand or send us a text. We're stuck at 8. Claire and I do not count, so that's 10 out of 15. Oh, actually, no, it took us out. We have 17 people on, so.
All right. Well, I'm going to close the poll for now, and we'll see how we did. Okay. Let's see the results. Do you all see the results? You can. Okay.
So I can see the poll results.
Okay.
I don't know, Claire, if you can.
Can't.
Okay, because we're using the same account.
Yeah.
You want me to stop sharing? So
no, it's okay.
Go ahead, stop sharing.
No, that okay. I can stop it. For some reason I can't see the answers, but what did everyone have for breakfast? Furfur?
1% had furfur, 2 people had inqulal, and everybody else said they had other.
Oh, okay.
Yeah, I was surprised. I was expecting more furfur and inqulal, but doesn't look like it. And then the number 2, we had 2 people who think that they're very good as an educator, 4 people who said they're average, and then 2 people who said they're just beginning to learn.
Great. Well, thank you everyone for taking the poll. All right. Okay, so we'll move on. So that's Zoom. And again, if you have any other questions about Zoom, we can talk about that at the end. I also wanted to mention, I realized that some people may be using their mobile device to connect. I believe all of this said, I believe it should look very similar when you're connected on a tablet or a phone, but some of the options may be compressed into a menu. So at the toolbar, you may see 3 little dots. That's the menu. If you open that, you should be able to see all the options I talked about, like the chat box and things like that. But let us know if you have any questions or need help navigating Zoom. Okay, so we wanted to talk also about data use. So our sessions will all be on Zoom video conference, and we understand that that is going to require a lot of data, and it requires that you all have a reliable internet connection, which we know can be a challenge in Ethiopia. It can even be a challenge for us sometimes too. So we wanted to just really encourage you to, if you don't already have, or you don't already know of a place that has a reliable connection, think about where you will be when you connect to these meetings, and try to find a place that will be reliable for you. We also wanted to mention that we really want you, if you don't already have an unlimited data plan for mobile data, we would like to help you purchase that. So we are able to provide up to $50 US or 1826 birr for each month of the training, so for the 3 months of the training. And we will reimburse you for purchasing this data plan. And I will send you an email after the orientation to tell you how you can get reimbursed. But we really encourage you, if you don't already have an unlimited data plan, to purchase one, and we will reimburse you for that. Because it's so important that you have a good, stable internet connection for the course. Okay, and that's all for logistics. So I'm going to stop sharing, and then Dr. Slushy will say a few more words about expectations.
All right, can you guys see my screen?
Yes.
Great. Okay, so expectations. I'm gonna share a couple of words with you in terms of what our expectations would be. One is being on time. Now, I am an Ethiopian in many ways, but when it comes to time, I'm very different than most Ethiopians. And it's not just me, but for us, we only have 90 minutes. For us to be able to use our time effectively, we want to start, sharp at our start time. So please be sensitive to everybody else's time. Don't start looking for good internet connection when the time starts. Do that 30 minutes prior, and try to be there early so that this course will be successful. Second thing is communication. We're going to do a lot of communication via email and via Telegram. And for this course to be successful, you have to check your email regularly. You have to respond regularly when we send you requests via email or a Telegram. So it is a very, very important thing that you need to pay attention to in the next 3 months. The third is engagement. So I have 2 pictures for you here. The top panel, you can see that they're all engaged, they're talking to each other. And then on the bottom, you can see there are 4 others. Someone is on their phone, someone is sleeping, someone just turned their Zoom on and they're drinking coffee and doing something else. If you really want to get something out of this course, you have to be engaged. When we give you assignments, if you come unprepared without doing your assignments, it defeats the purpose of, taking part of this course. So it's so crucial that you stay engaged throughout the whole course to get the benefit of the course. Then the last thing is you're going to have assignments. Treat this as a typical course you would take either when you were doing your residency or when you're undergrad teaching. There'll be homeworks, there'll be group assignments that we will give. You have to show that you are vested in this process, and assignments, when you do them, is when most of the learning is going to happen. Really what we do in the classroom is supposed to be a catalyst to the time that you're going to spend either by yourself or being together as a group, working through some of the things that we're going to share. So just wanted to set these things from the beginning of the course, that as a learner and educator relationship we're going to create for the next 3 months, these are going to be what our expectations will be. So, what's in it for you? Why should you spend your wonderful Saturday afternoons, 12 sessions every Saturday, coming up, you invest your time and energy on this. And these are our perspectives, and everyone has their own reason and drive to why they do things. But we hope and pray that you're doing this to be a better educator or a better leader, and that you are going to invest on yourself and on your ability to be good at, better at what you are doing. We think this is an excellent platform for you to start to network. Most of you work in institutions that sometimes have the same and similar challenges, and then sometimes have unique challenges. So this is, in our opinion, a platform for you to think about these things, to brainstorm about these things. Not only are you going to network with each other, but you also will be networking with those of us that are at Vanderbilt, and we hope that this will be a relationship that is created that will continue for longer. Third thing is, this is an Ethiopian Society of Anesthesiologists endorsed postgraduate continuing medical education course. So this training is something that you can put on your curriculum vitae, and at the end of this training, if you continue to show engagement and if you do your assignments and so forth, you will get a certificate for completing the Impact TOT course. And the completion of the online part is a prerequisite for you to be able to be part of Part 2 training, which is how to do simulation training. As you all know, there is a lot of push in the country to do high-level simulation training at training institutions. So we believe that this will be a great investment in you and in your future career. So with that, I will stop sharing my slides, and we will have a question and answer session. We can try, if you have a question, feel free to unmute and ask us. Yes, go ahead.
Yeah, thank you. My internet was a little bit unstable, and I missed some of the how to use Zoom. But,
Okay. We will share the slide deck with you on the, how to use Zoom portions. And then, talk to one of your colleagues and they can go over what we shared with you. And then if you still have questions, please feel free email Claire or email me, and we can go over those slides with you. Okay. I see a question from Dr. Destalem. Can we have materials to read on the topics of the trainings? So I am assuming that you're asking to get some materials ahead of time to prepare before the sessions. He's already starting the flipped classroom model. So yes, we will ensure that you will get materials beforehand so that you'll be prepared for the future sessions. Any other questions? And feel free to unmute and speak up. Dr. Hussein asks the assessment method. I'm assuming you're asking about how we're going to assess you as a learner for this course. Okay. We will, that's a good one. So, which I'm glad you mentioned it. We will have a pre-survey, a mid-survey, and a post-survey that we're going to send to you to try and gauge how much you have gotten from this experience. During the course, during the whole time, we will give you specific tasks to do, specific assignments to do, and completion of those assignments would be one way that we will assess you. And the very last session, which is the 3-hour session, is going to be where you guys will be doing some of the presentations and the teachings, and we will see how much you have been able to incorporate what you have learned from these sessions. So those would be the 3 different ways that we will assess. Did that answer your question? Yes. Okay, I see a note. Okay, so Zemena says, can we have Telegram group and share the record so we can listen later if missed due to bad internet? I'm not clear. You're gonna have to help me with this. We will record these sessions for sure. And we do plan to give you access to these recordings. I'm not sure we can put that on Telegram just because it's going to be big video files. But we will create a way for you to have an access to the learning management system that we have, that we will put some of these resources on, and you will have access to them that way.
Mm-hmm. We can send out the slides from today, which also have some notes, so that may be helpful. And then in terms of Telegram, I'm new to Telegram myself, but I think in order to be added to the group, you need to have the Telegram app installed on your phone. There were a few people who I have your mobile number, but I couldn't find you on Telegram. So make sure that you have the Telegram app installed on your phone, and I will look for you again, and I will try to add you to the group.
Okay, good. The next question was, Destalem said he's not clear with when to use speaker mode versus gallery mode. That is really a convenience for you and how you would like to view things. So The gallery mode kind of shows you right now I am in the gallery mode and I don't see the slides, but what I see is everybody's and anyone who's turned their video, I can see their video. So it's especially when you're doing interactive things and when we're going to assign you to groups, gallery view tends to be best for that because you can see everyone. The speaker view is usually if somebody is giving a lecture. That's what I typically use. Is I use the speaker view. But at the end of the day, it is really your preference of how you like to view the lecture going, and does not necessarily affect what we do or how the lecture is given. Aman, if training material is forwarded before the session, as I think we will become ready. My flipped classroom model session is going to be short because they're already thinking about it and want to come prepared. So that is excellent. So we will do that as much as we can to ensure that the time we spend together will be helpful. Elizabeth said we can share the link on Telegram. What link are you talking about?
That was the video link.
The video link. Okay.
So if you record on the cloud, then you'll get a link in your email folder. We can share that.
Great. So we will do that. And whenever you have good internet connection, you can use that, that link to view back the session. That's excellent. Great questions. Anything else? Okay, well, thank you everyone. Oh, just be prepared for the surveys that will be coming soon. You'll see that in an email. It will be through a REDCap survey. So as soon as you see that, please make sure you complete it before our next session. So Hussein, that's going to be one of the assignments. Okay. And if you are in a place like, for example, where Hussein or Dastalem are, it looks like they have very good internet connection. It will be really helpful to keep your video on. Sometimes in Zoom, when you're speaking, you feel like you're speaking to nobody because everybody's muted and all you see is just names and blank screens. So if possible, and if you have good internet connection, keep your video on so we can have some kind of interaction and know that you're seeing each other. And then lastly, don't forget to send your phone numbers to Claire so she can add you to the group. That's all I had, unless somebody else has a different question. Thanks, Marie. All right, I see thumbs up, hand clapping. So people are awake, so that's good. All right. Thank you all. We'll see you next week.
Thank you, everyone.
All right.
Vamos a ganarlo.
Great.
Thank you very much. Thank you, everyone.
Thank you.